I'm Michael Koran. We have Dr. Ron Goldman, who directs the Early Trauma Prevention Center, and he's going to tell us other ways of preventing early trauma, which, according to Dr. Goldman in our first show, leads to much of at least contributes to violence in this country.
Mm-hmm. Okay. I want to ask the audience, and you can do this also, Michael, to close your eyes for a visualization that I will describe. Imagine you are lying comfortably with someone who you feel emotionally close to and having pleasurable physical contact.
Yum.
And then imagine...
My beyond significant other. I can feel
Okay.
her. Oh, that's so nice.
Then imagine...
Am I allowed to do this during the day and when I'm not on the
Okay,
show?
there's more to this, Michael.
Oh, I'm just like this?
Okay, please be silent, Michael.
Yeah.
Okay, while you're lying there with this person you enjoy being physically close to, a few people enter the room you're in, and they proceed to separate you from this other person, pick you up, and carry you into another room, ignoring your vocal response and attempt to free yourself. They can overpower you because there are a few of them. They pick you up and they take you to another room. And in this other room, they remove your clothes, again, ignoring anything you happen to be saying about this or screaming or whatever. And then they lie you down on a table and they secure your arms and legs so that you can't move them. The only part of your body you can move is your head. So you were secured naked on this table. And then another person enters the room to confirm that you are immobilized physically. And then this person picks up a few instruments to do a genital procedure on you, which we call circumcision. And this involves a clamp, it involves a knife, surgical instruments to complete this procedure, which takes about 15 minutes. And all this time, the person doing the procedure ignores your cries or whatever responses you have. And so imagine this being done to you and imagine how you feel. Let's take a few seconds. Imagine how you feel this being done to you. This forceful genital cutting. Okay, and then now you can open your eyes and come out of this visualization. And do you have any comment, Michael?
It felt nice. The cuddling part felt very nice. Thanks.
Yeah.
The rest was a bit of a shock.
Yeah.
Painful.
Okay.
Or in your language and maybe mine, traumatic.
Well, it can't help but be traumatic. Okay.
And what's the difference between pain and trauma?
Trauma is overwhelming. So what happens to some infants who are being circumcised is they withdraw in shock. So if they're withdrawn, is emotionally and psychologically, they're not going to be crying. Okay, but so depending upon how different infants respond in different ways, but very often the assumption if an infant is not crying, the infant is okay, is incorrect, because infants can withdraw psychologically when they can't withdraw physically. So let's take a look at a couple of images here.
Uh-oh. You sure I'm happy seeing this?
So here's an image of an infant is restrained under that cover. Can't move his arms and legs, and you can see the instrument going to the genitals of doing the cutting, removing the foreskin. And let's go to another one. Okay, this is the restraint. It's literally called a circumstraint, and you can see the straps that hold the arms and legs from moving as the infant is lying on his back.
This is me, little Mikey. This was just one of the many traumas.
Now let's take a look at these diagrams to see how the circumcision is done. You can see in illustration A, the sharp instrument is inserted to separate the foreskin from the head or glands of the penis, because the foreskin is naturally adherent to the glands in infants, and it doesn't separate until maybe a few years after life. It depends on the individual. It could take even longer than that. Then in illustration B, there is a what they call a bell that is put over the head of the penis after it is exposed by cutting away the foreskin. After the foreskin is separated from the glands, it is pulled back.
Is this the hospital? This isn't the religious ritual.
This is the hospital circumcision.
Right, the religious one is very different.
Well, let's keep it on this for now, Michael.
Yes.
Okay, so you can see in B, the bell is put over the glands with the foreskin redrawn, pulled back. And then the bell is tied in place in illustration C. Then in D, the infant's penis is put into this clamp device
Oh yes, wow.
through a hole. By the way, this is the most common device that is used to perform circumcisions in American hospitals. This is called a Gomco clamp, G-O-M-C-O. So you can see in D, the penis is put through the hole in the clamp so that it protrudes above it.
Yes.
And then the bell, the end of the bell is connected to a lever device of the clamp, which is then screwed at the end. You can see on the right of the screw part.
Yes.
And so what happens is when the screw is turned in D, it clamps. The clamp is forced up against the bell to put extreme amount of pressure on the foreskin, which separates it, which cuts it.
Wow.
And then so the knife is used to complete the separation of the foreskin. So that's the procedure of the circumcision. Let's get back.
Now this was done not this way to Jews for over 3,000 years.
It's been done for a long time.
And
Okay, that doesn't make it any more pleasurable for the infant who has to experience it, right?
Jews have done extraordinarily successfully in the world, though.
They've done what?
Extraordinarily successful with Nobel Prize winners and.
I don't get your point.
So it seems that
A prize for what?
Jews have done so well in the world, even though they've been circumcised. I mean,
It depends on how you make that judgment, Michael. I don't want to get at. We don't have time to talk about Jews versus non-Jews because I want to stay on the subject of trauma here.
right, but I'm just saying that these people who've been circumcised are turned into great human beings, like Einstein, Freud.
A few.
Many, all the great musicians. And
We don't have time to get into that sidetrack. I'm sorry. Otherwise, I have plenty of responses, but I'd like to get some other information out to our friends that are watching here. Okay, so circumcision is highly traumatic. I happen to have written a book called Circumcision, The Hidden Trauma, which is endorsed by dozens of professionals in medicine, mental health, and social science. Okay, and again, the point here is that this is a trauma which is overlooked. In hospitals, the infant is taken to another room, just as in the visualization, the person was taken to another room. So the mother doesn't get to witness what she's agreed to, and this is signed by a consent form by one of the parents in American hospitals to give written informed consent to do the circumcision. Now, back around maybe the 1970s in this country, there was no signed consent for circumcisions, and some infants were being circumcised without any consent, amazing as this may sound today. And then some parents got a little upset at this, to say the least, and because of review of this procedure, they started introducing these forms which had to be signed by a parent. So again, the point here is that parents don't observe what happens to the infant. What they do observe is when they bring the infant back to the mother, very often the mother observes a change in behavior of the infant. Where the infant was peaceful and calm and bonding with the mother, now the infant could be irritable, could not make eye contact with the mother, have difficulty in feeding, have just still getting over this intense traumatic experience of having part of her genitals cut off. So it's something which is very significant, and there's been some research on this practice. For example, they had done, there was a survey study that was done that found that men who were circumcised were more likely to have difficulty expressing their feelings than men who were not circumcised. Again, this is a survey comparison of men circumcised and men not circumcised.
How would they discover whether they have difficulty expressing
Well,
their feelings?
they did a survey. In other words, there were survey questions.
You asked
and they
them,
they
do
asked,
you have trouble expressing your feelings? Was that the question?
I'm sorry?
Was that a question? Do you have trouble expressing your feelings?
I don't know the specifics of the survey. I know that I'm here to talk about the results of the survey. The men who were circumcised had much more difficulty expressing their feelings. And another thing they found was that the men who were circumcised were 4.5 times more likely to use an erectile dysfunction drug.
This is a new study, now, of course.
Okay, so which is to confirm that there are sexual consequences to being circumcised.
Wow.
And, you know, and looking at the diagram of what's cut off here, I mean, let's talk a little bit about the foreskin. The foreskin is assumed to be very insignificant. Okay? And I did a survey some years ago at a men's gathering I was at, and I asked men, guess the area of an adult foreskin in square inches. So I asked men to make that guess, and the range in guesses started as small as 1/2 a square inch for an adult foreskin area. Okay, now to get to the point here, the typical adult foreskin area is about 12 square inches
Wow.
of highly erogenous tissue.
12 square inches.
12 square
a
inches.
ruler.
With thousands of very sensitive nerve endings.
Sounds like you could fly.
And this foreskin protects the glands because it covers the glands.
Yeah.
This is a double layer of skin now, which protects the glands when the penis is flaccid, and then retracts down the shaft when there's an erection. Okay, and then this foreskin can slide back and forth
Yum.
on the shaft,
Wow.
which reduces friction
Yes.
and provides pleasurable sensation for
Wow.
the male and his partner.
Can we buy replacements?
So there are sexual advantages to having what's natural, what all the parts you're born with.
Yes.
Okay. So this is something that doesn't get explained. For example, if you go and talk to some professionals about circumcision, they don't know a lot of the adverse effects of circumcision.
That was the best advertisement for foreskin I've ever heard.
Well, I'll tell you another one, and that is on our website of the Circumcision Resource Center, there is a page that identifies over 100 adverse complications and risks of being circumcised. Over 100. Actually, 126 is the number that we have on there right now. So there's a lot of negative factors that aren't considered with circumcision. People think that because this is common in the United States, and the rate's coming
It
down.
still is? Oh, it is going down.
It's coming down.
Wow. Thanks to people like you.
Well, lots of people are working on this.
Yeah.
It peaked around the late 60s, early 70s at about maybe 85% of male infants were being circumcised. Now it's closer to around 55%.
Wow.
Okay, so it's dropping, and we've got a long way to go. Okay, because 55% is 55% too much.
Yeah, but the trajectory is.
The tendency is to be is to decreasing. Okay.
And in
So
Europe,
we're working on that.
And is it different in Europe and Japan?
Of course. Okay, here's an interesting fact that very few people know. First, Muslims circumcise, mainly when their children are older. We know the Jews circumcise. but not all Jews circumcise. Circumcision is not universal anywhere that Jews live, whether it's here in this country, there are Jews that don't circumcise. In Israel, there's actually an organization that opposes circumcision in Israel. In other countries in Europe where there are Jews, there are significant proportions of Jews that don't circumcise. Okay, so what I'm getting at here is, aside from Jews, Muslims, and Americans, the rate of circumcision in the rest of the world is about 5%.
Because I remember reading Nelson Mandela's autobiography, and he had 18, I believe, was circumcised.
Yeah. Well, again, this is done by force in Muslim cultures. Again, you have people who are physically overpowering, and they're also sold the cultural idea that you'll be a man now when you're circumcised.
Yes.
You'll be accepted into society. You can get married. You'll have all these cultural advantages, which don't necessarily have to be, but that's part of the brainwashing to get these young men to submit to being circumcised.
And some people
cultural
think
brainwashing.
That it's a health measure. I believe I read that AIDS, and heard that AIDS was not spread with people who were circumcised as much as people who had foreskins.
Okay, that research has been reviewed and refuted by many people.
Oh, really?
Yes. And in fact, there are over a dozen international organizations around the world that take positions opposed to circumcision. No national medical organization in the world recommends circumcision. Claims that circumcision has potential health benefits, and I underline the word potential, not actual, it's potential. Those claims have been refuted because they had flaws in the methodology.
Wow.
Understand that these studies are done by people who have an agenda, that want to come out with a positive outcome of having some kind of potential benefit. And understand also that these benefits are only going to affect, in the best case scenario, 1 out of 100 to 1 out of 100,000 males. So the huge majority of males who are circumcised are never going to be affected by, even if these claimed benefits were true. They're only potential, and they're only going to affect, potentially, if the benefits were true, a very small proportion. So again, if you want to avoid STDs, for example, rather than have a part of your penis cut off, use a condom. They're much more effective, 99% effective if you use condoms properly. So that's circumcision. Again, we're talking about potential increases in violent behavior. Certainly, there's separation of the mother. There's needs that are unmet with circumcision. There's maltreatment, and there's trauma. The 4 factors that contribute to disrupting the bond between the mother and child. And again, the infant's behavior changes, very likely to, and less sensitive to feelings.
And so are circumcised men more violent than...
I'm saying they're more likely to be. Doesn't mean they will be. And they're more likely to be than if they're...
And how do we know they're more likely to be?
Because, again, there's comparative research on this. I mean, just look at the rate here of men in violent crime and homicides compared to European countries that don't circumcise. I mean, there's lots of ways to look at this. But part of the problem here, Michael, is that there's very little research that intends to look at the negative aspects of circumcision, because who's going to do that research? If we're in Europe, circumcision is not common there. They're not interested in doing studies about circumcision, for the most part now. I'm saying generally speaking. Europeans are not going to be studying circumcision. So Americans are likely to be the ones that want to study circumcision. The ones that do the studies are circumcised, okay? And they have circumcised sons. So they have a personal, professional, and cultural bias to view circumcision positively, okay? So that bias influences how they do their studies, what they're going to study, how they're going to report it. And again, the American studies have been refuted by there's also an organization in this country called Doctors Opposing Circumcision.
Wow.
Okay, so they have refuted the studies done by American investigators, and Europeans got together a group of 38 professionals, medical people, and they submitted a report to the American Academy of Pediatrics that basically comes out and calls it like it is, that the AAP has a cultural bias, and that we're refuting that research. So again, there are other sides to this issue, in addition to what you might be told by your typical American medical doctor.
But you've been a very individually and very unviolent culture.
There are other I'm saying there are other problems that come up in culture besides violence. Okay. By the way, domestic violence is very common in Jewish culture, as it is with other cultures. And
probably less so, I would imagine.
well, I'd really like to get on to a few other topics before we only have a few minutes left. Okay. We also do something in this country which is non-maternal infant care. Okay. A significant contributing factor to this is that 58% of mothers of infants work outside the home. Okay, this is very significant. So what happens here is these mothers go to work, and for the most part, they have to find somebody else to take care of their infants. Okay, and so there's a long hours of separation here between a mother and an infant. And by infant, we're talking about the first year of life here, just to give a definition of a time span here. So infants who are separated from their mothers, this is an extremely disruptive experience because infants urgently need to be with their mothers. Go back to the research study before about peaceful societies. 80% are peaceful to a large degree because the infants are carried on the mother's bodies throughout the day for the first year of life. Well, here, the infants and mothers aren't even within eyesight of each other, let alone being carried on the body. They're in another town, for example, if the mother goes to work, 20 miles away. So it's a serious problem, separation of infants from mothers, and it's a cultural problem here. And we need to take a look at this, and there's a political aspect to this. Because for the most part, we've only started to look at having mothers have more maternal leave so that they can be with their babies. Okay, in this country, the typical maternal leave, or the national maternal leave policy is a minimum now of 12 weeks of unpaid leave. That's the national policy. Individual companies can do better than that, and some do. In Europe, the national policies of maternal leave tend to vary from 1 year to 3 years.
Wow.
And here's the key. This is not unpaid leave in Europe. This is paid maternal leave, 1 to 3 years.
On that happy note, you might you might leave us with a song, yeah?
Okay, I might leave you with a song.
We have 3 minutes.
Okay, so let's get on to our politicians and have them come up with a policy.
Amen, brother.
Of extended paid maternal leave
1
here
to
in
3
this country,
years, yes.
so we can keep our mothers home to take care of our infants and have a more peaceful
that would
future society.
Get people elected. That's a good platform to run on.
Okay, let's do the song.
I love Ron's singing also. I learned a lot. Thank you so much.
You're welcome, Michael.
I hope you all did.
This is called One Song.
2 minutes.
The music is by Marvin Hamlish. The words by Alan and Marilyn Berger.
2 minutes.
If we all sing one song of love, one song of peace, one song to make all our troubles cease, one hymn, one theme, one hope, one dream. Imagine what tomorrow would bring. We all sing one song. If we all learn the words, think how great sound would be. Since the tune is in freedom's key, one voice we hear, so pure, so clear. Imagine what tomorrow would bring if we all sing one song. There's just one sun that warms our day. Same moon and stars light our way. This little ball whirling in space, it's our only home, our only place. If we all sing one song of hope, one song of peace, one song to make all our troubles cease. Imagine what tomorrow would bring. Just imagine what tomorrow would bring if we all sing one song.
Thank you.
One song.
Thank you, Dr. Ronald Goldman.